What's the next one for you guys? Is it poison?
Fire safety. Race.
Okay.
Poisoning was after that.
Okay. So what does RACE stand for? Does anyone know?
I forgot. Rescue.
So yeah, so the rescue or remove, right? So we get patients out of their rooms. How are you going to prioritize what patients to get out first?
Ones that can't get out themselves.
Immobility and oxygen, right? Because oxygen's a huge fire hazard, so you don't want them in the room anyway. So patients on oxygen, so all of them. Okay, and then A stands for alarm, so just kind of get help, call 911, things like that.
Wait, what's A?
Alarm, so you want to get help. And then C is you're going to confine it. So shut the doors, windows, try and keep the fire in that one area. And then after that, E, evacuate. So get out. And then if it's a small fire, just extinguish. But only if it's like in a trash can or something. Okay. Any questions on that one? And then fire safety, just like stop, drop, and roll. Just don't do anything stupid. No petroleum jelly with O2. You guys know all these stuff. Okay, next one is poison. So if it's poison, you want to call poison control. You want to try and determine like how much they drank, if they drank it, what they drank, things like that. Okay, so poison safety, just kind of determine what it was, how much, when they took it in, so you can kind of help the doctor and the poison control do an intervention on that. And then obviously, if they still have it in their mouth, like get it out, or if they're like immersed in it, stop the cause, right?
How would they be immersed in it?
If they fell into like, I don't know, like gasoline or something.
Superhero here.
Like they fell into a bunch of fertilizer. Okay, this one's super easy. You guys have had all these questions in every test. You know how to do a care plan. Do you have any questions on it? Like it's just about this topic.
So it's just nursing process for in general? It's just like what to do first.
It's just nursing process isn't like care plan. Like how you're going to develop that.
Oh.
That's what it means. Just like setting goals, you're going to assess, this nursing process is assess, do, teach, right? Or API, right? Assess, plan, intervention, evaluation. It's just things we've been doing all semester. It's just going to be on the test. Okay. Next one is electrical safety. So, does anyone know what the third prong does? As in the outlets?
It's an anchor, right?
It grounds the electricity, right? I guess Adam told me one's positive, one's negative, the other one's grounding. I don't know.
Adam told you that?
Yeah. So like in the plugins, you know how there's like the three things that go in? I don't know what to call them. The third one's for grounding electricity.
You can't plug in major equipment unless it has a third prong, right?
Yeah, usually. Okay. Here. Mm-hmm. In the hospital, the ones that are red, it means that has a backup generator so that if the power goes out, it can still work. So that's the things you plug in, the IV pulls in, nebulizer, like things like that. So you wouldn't let the patient plug in their iPhone charger because if the power goes out, who cares? You know? Things that are kind of crucial.
No Facebook for you.
Like the PCA pumps, yeah. So, okay, and then I think I have some extra things. Okay, so also, do you guys know what hyperglycemia is?
High blood
Yep.
sugar?
I think that's on the test. Just know what it is. Insulin and heparin, make sure you know. 2 nurses need to look off the dose. What does this mean? Pruritus?
No idea.
Itching. Just in case they talk about that. So that could be a sign of allergic reaction, right? So you give them Benadryl or something, like an antihistamine. Okay. Also with ampules, how we talked about how that you can store them longer, you can also sterilize ampules. So that you can make them sterile so they can go into like the sterile field in the OR or whatever. You need a medication.
Can you not sterilize vials?
No. Okay. you guys have any questions?
Wait, so are only ampules allowed in the OR then?
Depends, like if they already have it, they use sterile technique and they get the medication out. But if they're physically just like need the medication right now, they can bring an ampule in and like break it open. Does that make sense? Yeah. But like you see anesthesiologists like behind the curtain, he just doesn't use sterile technique, right? Are you guys done the study guide then? Most of you?
Yeah.
Except for you, right?
Yeah, on the first section, but Taylor said he can email it to me.
Sweet, well tradesy.
So for the nebulizer, this next is just humidified air. Looks like vertical dry.
Yep. You can put medication in it, so it could have humidified medication air. Yeah, and that's all you need to know. You can put it in patients just if they have a face mask on with oxygen already. You can just sneak it in there. Sometimes for children, you can actually make the nebulizer into a face mask, so it's easier for them. Yeah, just let them breathe it in. I don't even remember that being on the test, to be honest, but you should know what it is, so.